Hi, my name is Dr. Deborah Zeitlin, and I'm a Senior Consultant General Paediatrician. So I see two main groups of patients. The general paediatric side, so all of the common illnesses of childhood, chest infections, urine infections, asthma, skin rashes, and children who have the usual winter viruses. On the other side, I also provide a complex care service, and that's really for children who have two or more ongoing conditions, or conditions that are rare or difficult to treat, and where maybe they've been struggling to find a suitable management plan going forward. So I started out in paediatrics quite a long time ago, and I ended up doing paediatric intensive care medicine, which is a fantastic training for any paediatrician. And I was actually a paediatric intensive care consultant. And it really lends itself to knowing about all of the different conditions that can really contribute to very unwell children. But I really miss talking to my patients and their parents. And so I took a step sideways into general paediatrics, but the hospital that I work at is Great Ormond Street Hospital. So the general paediatrics there is actually really quite specific, with huge input from the very diverse and comprehensive other subspecialties in paediatrics, like gastroenterology, paediatric surgery, neonatology, endocrinology. I think if you name it, we've probably got it at Great Ormond Street. So that's on my NHS practice side. And really what I found was that in this country, there isn't really the NHS facility to have a family paediatrician or a general paediatrician looking after you or your child, going through up until the age of 16 to 18. And so that's really what I provide, a main part of what I provide in my private service. I think that one of the really sort of valuable aspects of the way that I see patients and the way that my consultations are structured is that parents and patients have time. They have time to tell me their concerns, time for me to really explore the issues. Even in the general pediatric side, where it may just be tonsils or adenoids or a skin rash, there's usually something else that parents want to talk about or a child wants to talk about. So I'm very happy for patients to come along with several concerns, and I try to provide a holistic overcare so that we treat not just the illness, but really so that I'm addressing the child and the issues there.